Ready? So like shoulder muscles, you've got the pectoralis in that breast region coming out. It's the one that adducts or brings the limb back into the midline. The deltoids, I call them the shoulder pad muscles. Back here, the trapezius, remember it's got a diamond or trapezoid shape. It's a thin, flat muscle that goes all of this. It's been cut here, but it would come all the way up here. So it comes off the vertebral spinous processes out to the spine of the scapula and positions, like this part would pull the scapula up, pull it down, or just pull it into the middle on either side. Here where they've cut the trapezius, you can see the rhomboids behind it, kind of like an offset square. That's a rhombus in mathematics.
So it would be like right here.
Yeah, it's a group of muscles. It's these 2 or 3 muscles here.
Does it also go this way?
Rhomboids?
Or just that?
No, that's it.
Okay.
Yep. These are those epaxial muscles here that we're not doing. This is the serratus. Remember the little serrated edge, like
Yeah, they got the little lines.
little lines coming off of the ribs, going back to the medial border of the scapula. Really pull the scapula in to the midline. What else? The brachial plexus over here. So, like on this side, so this arm is being held up like up in the air, so but you can see biceps and triceps, right? It's like anterior part of it. And if you just like here you can see a lot of the spinal nerve roots coming out, going out, some of that spaghetti going out to the shoulder muscles that we're not worried about. But then we come under the clavicle, and here we have lateral and medial cords, and then you can see the M, the 3 legs of the brachial plexus coming down. That musculocutaneous nerve going right into the biceps. You can just see it going in there because that's the biceps. The median nerve is going to continue on down to those forearm flexors, and then
It's the ulnar.
the ulnar nerve, yes, that's going to go all the way down around the medial epicondyle humerus, all the way down to the hand, which we'll see on the arm itself. That's pretty good for that. And actually, let's just continue down. Here's that same M of the brachial plexus. Realize this is now almost anatomical position, so you're looking anteriorly. There's the the M, musculocutaneous nerve going right into the biceps muscle, median nerve continuing on down, follow it on down, and right into those wrist and digital flexors in the forearm. And then there's the ulnar nerve coming down the medial side around that medial epicondyle of the humerus, the funny bone where you hit it, nothing funny about it. And then it goes behind that tendon there, and then continues all the way down into the hand, to the inner osseous muscles, or the intrinsics of the hand.
All right, so that's the one that flexes, and the one posteriorly is the one that.
Yeah, that's all flexion on the front, yes. And the muscles, just to be clear, you got biceps. We're just calling all of these muscles here forearm, or wrist and digital flexors.
Mm-hmm.
On the posterior side, you can actually see the posterior cord and the radial nerve diving back there. So that's the brachial plexus. It's going to dive back there. It's going to come out back here. So here's the back of the posterior aspect of the arm, the elbow, back of the elbow there. That's triceps muscle, and you can see that nerve going into the triceps. It's going to go behind here, and then see if you follow these tendons down to the back of the hand. These are going to be all of the wrist and digital extensors, because the tendons go down to the back of your hand, extend back that way. And with that, dramatic thunderbolt.